Hi, my name is Lloyd. I'm here from the Movement Company, one of Freeform's partners. We are based in the Glebe, just off of 4th Avenue. I'm here today to go through some common movement errors that we see on a day-to-day basis in the clinic. And then Vanya's going to go through some strength exercises to help build on some of those movement foundations. Outside of the realm of the sporting world, like everyone day to day at some point will have had some sort of lower back troubles. You see that quite regularly being at the physio, chiro and the sports massage clinic. A high majority of people come in with some sort of low back issue that we can either diagnose as something going on in the glutes or in the SI joint, the sacroiliac joint, or something going on with the vertebra in the low back. What we use regularly to help treat the issues there, the weaknesses, alongside chiropractic adjustments, physiomobs and massage, are these two exercises, a variation of a glute bridge and a variation of a side plank. So the first one, the glute bridge, we haven't really come up with a good name for it. We Luke and I call it lots of different things. SI glute bridge. The name of the game here is to create a nice bit of space between the hips. So you're thinking of not just lifting with a single leg, almost like you're rolling over without this knee following. So we're here, tilting the hips over, squeezing the left glute while letting the right relax, and then slowly lowering back to the start. Drawing the ribs down, so as to not arch the back, and then controlling back down. And then the second one is a side plank variation. So we get people to just slightly hinge at the hip, and instead of focusing on going straight up, we get people to thrust through. So it kind of also introduces the hip hinge slightly. So from this position here, we push through, up, again, drawing ribs in and down, whilst also squeezing glutes and slowly hinging back to the start without thudding down and without losing tension at the ribs. So we get tension and then we thrust forwards, looking straight ahead, knees together, knees into the ground, slowly lowering back down, up, through, slowly lowering back down, working obliques, muscles on the side of the trunk, and obviously on the glutes too. Tends to help stabilize things a little bit.
So for me, when I'm working with somebody dealing with low back pain, there's kind of two components that I want to teach my clients how to do properly. The first thing is proper bracing with any of the exercises and making sure that there's no movement going on through the low back and that they're hinging properly and moving properly through the hips or other joints that should be doing the moving from. So the most common issue that most people with low back pain is worried about is how to do a deadlift. When we're deadlifting, you want to, again, properly engage your core muscles to brace that low back, and then hinge your hips back, come down, and then squeeze your glutes to come back up so that there's no movement going on in here at all as you're doing that exercise.
Yeah, it's a really great point actually coaching the deadlift, because we have some equipment at the gym like kettlebells and light weights. We kind of just introduce the umbrella, the top of the umbrella, the hip hinge, which is the start of that movement. A common error that we see a lot of people with low back issues is that they tend to fold. So they'll keep their hips in one place and fold over the hip to pick something up, as opposed to doing what you were coaching there, sending the hips back and bending the knees or not. So yeah, perfect. That's what we would get ready to push people on and improve and progress their hip hinge. So that's great.
It's really important to learn how to deadlift properly, just because it's the proper way for you to be lifting things. So if you're at home picking stuff up from the floor, moving furniture around, you want to be able to do that properly and learn how to use your hips and not do things through your low back. And the second component is kind of counterintuitive because depending on what you're doing, you want to be able to stabilize the core, but then you also need to be able to rotate and be able to move without pain as well. So a great exercise that I use a lot is called a Pallof press, and there's many different variations on that. But if we're working specifically on how to control rotation, what you want to be doing is keep your arms straight, and then you want to make sure that you're leading with your core and not your arms. So keep your hands centered right in the middle of your chest and think about rotating through your hips, and then slowly control on the way back. So you're not leading with your arms first. Your whole body kind of moves as one unit, and you're learning how to use your core muscles to rotate through your spine. So thank you everybody for watching. I'm Vanya. We're at Freeform Fitness. We have 5 locations around the city. And this is Lloyd from the Movement Company. He's a strength and conditioning coach there. And they are a rehab clinic that has chiropractors, a physiotherapist, massage, and Lloyd as the strength and conditioning coach. We've partnered up to fill the needs of anybody who's wanting to rehab from an injury or potentially prevent injuries as well.
Prevention's the best cure, as
exactly.
they say. Thanks for having us, and look forward to getting out some more content soon.